Bonjour.
Bonjour.
And welcome to Foreplay Matters because
it matters.
I am Madame Beaucoup.
And I'm Madame Wee.
And welcome to today's
episode. It's so exciting. It's really interesting. But we want to let you know that we have a special guest with us today.
Woohoo!
Yes. It's Mr. Fluid. How are you today?
I'm well, ladies. Thank you for
joining
inviting
us.
me.
We got some
Appreciate
testosterone
it.
in the house today.
With
Wow.
an actual prostate.
Yes, especially because today's topic is
Prostate stimulation.
yes, milking and rimming and all the exciting stuff that we're going to talk about. So we have a huge following for men. So definitely our fellas, tune in and DM us and let us know what you like about this episode. But it's for you. So hopefully you get a lot out of it.
And I'm looking forward to hearing from our followers, our male followers, who is familiar with their prostate and prostate stimulation. And you can certainly DM. You don't have to put yourself out there.
So I guess the first thing we'll talk about is milking. What is that? Because when I say that to men, have you, and I guess the way I say it too, I'm like, have you been milked? Mm-hmm. Is that appropriate?
Like a cow?
Well, I think it's important to first back up and say, let's define what a prostate is.
Okay.
Right? So a prostate is a very small gland within a male, only men. And it's between
Really?
only men. We're the only
call it
ones
the
with
male
it.
G-spot.
It is the male G-spot.
Mm-hmm.
But it's between the bladder and the urethra. So urine passes through it when you're trying to pee. It also secretes fluids during arousal. So a lot of the pre-cum or the semen, but it's not necessarily semen. It's the fluid that helps the semen from your testicles flow out. So that fluid that you get when you pre-cum, and that clear fluid, that's the fluid that comes from your prostate.
Right.
You guys understand this. We don't.
Well, and for the women that are listening, it's like the episode from squirting. So, it's pretty much kind of the same process.
Yes, and we're going to actually get into the fluid that men have come out of their hole. The other hole.
We talked about our Skene's gland.
Not the urethra, but the other hole.
Yeah.
So that's what the
backdoor hole.
Yes. And that's what the prostate is, and if it becomes inflamed and not treated, it can be an issue. It can be an issue because you can have urinary issues, of course. You can have erectile issues, of course. So some of the signs, again, no one here is an MD, so please consult a doctor.
Right.
But if you are constantly, gentlemen, if you are constantly, using the bathroom and it's a stop and go type of situation, if it's a situation where you feel pressure on your bladder, but then you have to force yourself to pee, but these are consistent symptoms, right? So sometimes you just need to drink more damn water,
right.
And that's why you can't pee. But if this is happening repetitively on an ongoing basis, then you might want to consult a doctor because you might have some issues with your prostate.
Yes, definitely.
Well,
definitely men do.
down.
Yeah, and I like that we're having this episode, and it's near and dear. And the fact that you were like, let's talk about the prostate first. That's very important because a lot of men don't realize the age that they need to start getting their prostate checked. And also, too, the symptoms of what you're saying as far as like if you constantly feel like the frequency, like you constantly have that frequency to urinate and go to the bathroom, but you can't, and then nothing comes out. And the reason why I say this, because now you kind of hit some things that's near and dear, because my father actually had prostate cancer, and so those are a lot of the symptoms. So I'm really thankful that you actually brought that up.
So let's talk about how you get to it, because we talked about where it is, but we didn't talk about how to actually get to the prostate. Won't you enlighten us,
Well,
Mr. Fluid?
Mr. Fluid. We'll talk more about fluids in a minute, but to get to it. Now there are ways to stimulate it, and we'll talk more about those. But to get to it, there's only one way, and it's through your booty hole. It's through your anus, your rectum, your booty hole, whatever you want to. That's how you access it.
Mm-hmm. And this is another reason why it's so important to talk about the medical aspects. Although, again, as Mr. Fluid mentioned, no one here is an MD, and we're doing this for entertainment purposes. But there's a lot of information here that we want to share with you that's really important. And there are a lot of men that shy away from getting a prostate exam because it's through the anus, and so it's very important to know that there are medical reasons why you should go ahead and get that exam taken care of.
But we want to talk about the pleasure part of it.
Okay.
Because this foreplay matters. Because it matters. So we've already done the medical piece. Now we're gonna get into the pleasurable part of it.
Pleasure principle.
So when you say how you get to it, what are the different ways of getting to it? With your finger, with your penis, with some toys.
So you actually have to go inside the rectum to get to it, right? So the tools or the body parts that you use to get into it can vary, right? So it's the finger. It could be a dildo, it could be a butt plug, it can be a prostate stimulator, which is shaped differently than a dildo or a vibrator. However, some women's spot is a little to the left, so they possibly could use it too. But and it also can be a penis, an actual fleshy, throbbing, hard penis.
Long.
It actually does not have to be long.
Just because I said that,
Just
maybe I to say that. Maybe I wanted to skip to another subject. Maybe because I was like watching, listening, engaging.
Yeah. well, okay, yeah. But it doesn't. Okay, go ahead.
So the prostate stimulator is actually a little bit curved, and do you want to talk about in what direction, if you're using a digit or you're using a toy, would you be aiming for in order to stimulate the prostate?
So up towards your testicles. So we have that part taint, and you all is called gooch, I think. But that part right between,
never heard that word
you've
before.
never heard of it. Yes. So you all at this the gooch, and on us is the taint. So that part right between the testicles and the butt or the hole is the taint. So if you keep going down with your fingers and you insert your fingers inside of the rectum, you want to do your fingers up towards where the balls or the penis is going. If the guy is in doggy style or he's on his stomach with his hips maybe poked up a little bit, then you would want to do it, then it's down. But your rule of thumb is remember to go towards the penis. But let's talk about like getting into the hole.
Yes.
So we have 2 chambers. We actually have 3. But
3 chambers of death.
There's 3 chambers and the anus. I don't know if it's everybody's anus or just the guy, but I'm just going to speak about the guy's standpoint. So you have the sphincter. Am I pronouncing that right? So that's that outside chamber, kind of like your labia majora, where that's the one that we can flex. Yes.
Squeeze. Little wink.
Yeah.
Little wink.
So
like our Kegel exercise.
So that's the one that when it's time to relax, the deep breaths definitely help. And when you are doing this to a guy, it doesn't matter if he is used to anal stimulation or not used to anal stimulation. It helps if he's erect, because the prostate gland is on fire when he's erect. And it's stimulated and it's ready to receive. It's secreting. Well, some people don't secrete pre-cum much. I don't really pre-cum as much. I used to when I was younger, but not anymore.
Old man problems.
I don't know what grown man problem. You know what? Speaking of seeing the doctor, maybe I need to share that next time I go. That's a really good point. But he is aroused. So the prostate is turned on. The dick is hard, and also he's mentally
Right.
aroused, so his walls are down a little bit,
so to speak.
so to speak. So that's you want him to relax. He'll be more willing to relax than take deep breaths, and then you can get into the sphincter, which is the first gate.
Right.
Then there's a second gate that we do not control, right? So that literally has to be just gradually stretched open. Do not force it, because if you force it, the outside one will contract again and squeeze your finger, dick, dildo, whatever. So once you're inside past that second chamber, you want to reach up and you want to feel for something. So some people say, feel for a circle,
Like a walnut size.
a walnut size. Some people just say feel where it's rough, right? Because then you're trusting that people have eaten walnuts before, and you trusting that people have a good sense of touch and they don't have calluses on their fingers and all that shit.
Where does it change?
So, right.
Where do you feel the change?
Correct.
Right.
And you will feel the difference.
Yeah.
It's kind of like when you go inside a vagina, you feel the difference. Like,
What does
inside.
it feel like? It's like whenever I talk to women and we're doing a seminar on how to fight your G-spot, I always say feel the roof of your mouth.
Yes.
So does it feel the same?
Yes.
Okay.
Yes. So when you get to the part, because it's very slippery and hot inside, but when you feel where the texture changes, 9 times out of 10, that's where it is.
Right.
And then once you start feeling around more, you'll start feeling the lump or the walnut or whatever. So that's how you access it.
So then you start massaging that.
Yes. I mean,
She
I don't
wants you
want
to
to take
talk
over
slow.
that. I don't.
Yes, Mr. Fluid, we want you to take over.
I don't mean, ask me questions, give me reactions.
If we,
I don't-
first of all, if we had video, you would see like I'm so like into it. I love a
Face is
story.
flushed.
I love a good story. Love a good story. I'm always like, tell me more. Tell me more.
So that's how you actually access it.
Okay.
That's how you access it.
And that's the direct way to access it. So there's also an indirect way
Yes.
that you can access it as well. So can you expound on that? This is through the perineum, that taint area that you so nicely described. And I have a gooch apparently.
I've actually heard the tank, and I've been said they call women that too. I've never heard them say gooch. I've heard tank too, for a woman too, but that's probably because a man is saying it, and that's just some slang.
So you
Yeah.
can. Thank you. Finally.
Myself included sometimes.
Talk about how that can be accessed through the perineum, through the taint area indirectly, and
Right.
that could be orally, it could be digitally.
Right. So, she said digitally.
Digitally.
I'm like,
Digital underground, baby.
So I recommend this way for people who are, especially women, who are trying to do it to their man, because, and then this is a what is a sidebar, side article, whatever. But a lot of times, what I have learned in my experiences is that guys will. They will be not so open with their straight male friends about stuff. They will be more open with their lady who's open, and then with somebody who's sexually fluid like me, there's no holds bars on what they're sharing, because there's like literally there's no reason to be afraid of being judged with me, but when I've talked to my female friends who are trying to get their guy friend, or their husband or their boyfriend to do it, in situations where it's like,
no.
yeah, I've opened up and he opened up to me a little bit, but there's still some type of resistance. So how do I get there?
Exactly.
So, of course, let's start with some good old head, baby. You gotta eat the dick, not just suck the dick. Okay. Eat it, baby, like it's Thanksgiving. So you get it real good. You get him worked up, and again, this is your body. The body's getting stimulated. The prostate is on now, and then also his mind and everything. Like he's in it, right? And then you'll know when his prostate is really, really on when you feel that taint area right below the balls. So while you're sucking, you might want to like start rubbing the balls a little bit and, you know, going down and deep throating or pacifying the head, and then slowly slide down to the taint area. And when it's really hard, it's really on. So you can start by, you know, taking the dick, you know, stop sucking but jerking the head, or if he wants to jerk at his own pace, and then you play with the balls, and then you just go down and start licking the taint. Now, the females that I know who have done this part to their, you know, and they was nervous that they was gonna get punched in the face because their man's such a thug.
Right.
I don't know if he gonna punch me.
Right, but like he did a bid in jail, he might shoot me. So, and you know, I tell them, listen, baby, that's our G-spot. Did it 5 years or not? So, you know, they'll notice that their guy's legs will lock. The dick will stand up on its own. It's not a leaning tower. The breaths will be deep, or there'll be a groan. These are type of things that you should listen to see if your man is getting into it, because he is not going to tell you, yeah, go ahead, eat that ass. He's not. So you got, well,
that can be a conversation.
Yes.
And that's foreplay also.
Right.
Is to have conversation about, well, what do you like? Would you be open to? Have you ever?
Right.
You know, those types of things kind of get the conversation going. I do very well with having that conversation preliminarily, because I'm not trying to get 2 pieces and a biscuit to the temple in the middle of the night. So but you know, to your point, it can just be feeling your way through as well.
Yeah.
You know, but it's about respecting your partner and making sure that they're open to.
And I guess dirty talk too, like you said, because you're in what you were describing, you're in the moment. So you're letting us know he's ready. Right. And so therefore, of course, like, because the woman already had the conversation, like I've had conversations with my lover and I'm like, would you like to try this? Okay, yes. But then, of course, when you get into it, then it's like it starts to become a different story, right?
Yeah.
So what you're saying is giving us some information of how to kind of ease into that, right? And you doing the head, you know, letting them get relaxed, but then massaging that area, because I would think men are more comfortable with massaging.
Yes.
It's when you getting ready to get too close to the anus. Right.
Well, and then this is also, so it's different with Madame Buku, because their comfort level with you might be different, and the fact that you may have shared these different types of stories that you've done, they're still not going to be eager, like make it seem like they're too excited for it because they're scared you're going to judge them or it's going to be a question mark about them.
Well, what I'll say about that is that the dynamic with me and men is different because I'm a dominant. And so, like, we go into it with me guiding how this is going to go, but still being respectful of what their boundaries are.
Right.
So there is some wiggle room, so to speak, for me when I'm with someone. In that experience. So, but to Madame Wee's point, if you're all the way in it, you can start dirty talking if you're comfortable with that and kind of talk your way through it. Okay, so I see that you like this.
Well, the reason why I'm so excited about this because I'm trying to make it happen.
Well, and that's what
everyone knows that Madame Wee is a submissive. So, I can be a switch when I want to be, but I've had this conversation with my lover, and I was like, I want to milk you. And I just said it like I know.
Just don't say it like that. You guys cannot say these type of things to these men. They're going to look at you like you fucking crazy. They're going to be like, nah, she tested me. She probably saw that on Instagram. Nah, bitch, nah.
Exactly. And that's why, Mr. Fluid, we have you here. So this episode is for me. This episode is for me to progress what I want to experience and want him to experience forward.
So the example that I gave was definitely an intro.
Bright-eyed and bushy-tailed
It was an intro. And I feel like you can get there even without, like, you know, a conversation. You can just watch the body reaction because, again, it depends on the situation. So Madame Buku talks about the situations that she's in, but there's not a lot of men who that are.
I mean, I'm probably
in
the one. Most of the men are going to be like my man and not comfortable in that space. That's why it's like he's comfortable with the massage and, you know, and everything. But again, we've had the conversation. He's open to it. But when I get close to The anus, it's squeezing, and it's just
well,
like,
that's not what I meant.
Not today.
When I say comfortable in that space, that's not what I meant.
Oh.
I meant comfortable in this space to share openly, right? So she might get them there because of their relationship, right? But that guy that has been honest with her might meet you and not share that information.
That is very true.
So
there's an environment that's created.
Yeah, but
Correct.
men have, but that's not true, because men have shared that with me, that are comfortable with me and have shared that, and that's probably because they wanted me to do that with them. But I'm saying, as far as getting my man, I'm trying to experience it with my lover and move him forward, and that's where most women are, that want to do it with who they want to do it with. Right.
So the example I gave was definitely entry level, right? And every friend that I know have done that, have gotten the same reaction: tight thighs, toes may have curled, dick rock hard, deep breaths, right? And if they did get a verbal reaction, it was, oh, you nasty, what you doing? But it wasn't like a, bitch, you crazy. It was, I'm going to say something to make it seem like I'm uncomfortable, just in case you are testing me.
While the legs are kind of cocked up.
Right. So another way to do it is, I've had some female friends say that their hygiene is one of their biggest concerns. So I said, well, cook dinner for the nigga. Or the guy. Sorry for our white viewers. So you, cook dinner or just have some drinks, and then y'all take a shower together. And, he cleans you, you clean him. You might clean yourself again, because men sometimes don't clean that well. But you're cleaning him very well, right? Because you're cleaning your dinner, right? So then you lay him down. And you keep it going. You light some candles. You set the ambiance, right? And then you might give him a massage. You might talk a little bit nasty to him or whatever. But you keep going down. Yeah.
Having lube close.
Well, hold on.
Okay.
So then you go down and you're massaging him. And then you might pull his dick to the back. And then you are going to massage the dick from the back. Don't just suck it immediately. But when you go to suck it, he's going to naturally toot his ass up. So you can get to the dick. So then you start sucking. You start sucking it from the back, and again, that's going to be a crazy sensation for him, because the head of the dick, particularly the outside of the mushroom, is where a lot of the nerves are. And our dick is used to a rougher top part of your mouth, but now your tongue is softer, so he's automatically going to start going crazy. And he's probably going to want to slam the dick down your throat from the back, which means he's going to come up more in doggy style. And then that's an opportunity for you to come up and do the same thing that we talked about already. Start maybe sucking his balls while you jerking the head of it, and then start eating the taint.
I wish you guys could see the visual that's happening here with Mr. Fluid. He said don't call it milking, but what I saw.
So you do that, and then you go up and you start licking the taint a little bit. And again, you see his body react, right? So I would not recommend immediately going from the tester to see how you're going to react to it to I'm all up in your ass with a dildo.
Right.
I would, gradually, because you're introducing him to this, right? And I have had guys who have communicated to me, that, their girlfriend, one of them, their wife, was trying to do it, and he just kept, blocking her.
Right.
But we had a group situation, and I did it. And I did it and was, as a demonstration. We all were, in a good mood. So I was doing it. She was giving him head, and then I told her to watch, and he was just like, what the, trying to pretend like it was. He was like, what the hell are y'all doing? Y'all sit here trying to G me. So, and then I was like, let me teach you. So then I started teaching her on him.
And what did you tell her when you were teaching her?
Everything I just did. I was demonstrating, showing it.
But when you went into, because I want to kind of get into you actually entering the anus.
Okay.
So, because you tell us a lot of the foreplay
Right.
that needs to happen, which is great to get him comfortable, to
Right.
get him in the mood.
So when you get to it, so you do that, you do the taint, and then you just go start. You can just go doing a rim job, which is what some people call it, tossing salad, eating your ass, eating
with your
out.
tongue.
Yes.
So
it's
be
when
very descriptive.
It's when
licking,
it's when
twirling your tongue
it could be all of
out,
the above. So
inserting your tongue in and out.
Okay. Yes. All of it. And your tongue is very little, so you
want
may not be
to-
able to do it. Her tongue is.
Yeah.
So you want to, you lick the taint, and then you see how he reacts, and then you want to either this time or another occasion, you want to go a little bit further. And then if your man has a rotund booty, you might want to, you definitely, doggy style might be the better option, because he may not feel completely comfortable with having his legs in the air just yet. So have him in doggy style, sucking him from the back, doing that whole thing, licking the taint, and he might need to arch his back a little bit more depending on how well endowed his ass is. But you might want to open it up a little bit. Now, if you open it up a little bit, you're going to lose hand action, right? So then you're going to want to tell him to jerk himself off, because you want him to stay stimulated.
Okay, gotcha.
So if you got to use both your hands to get in there, you tell him to do it. Either you control him and dominate him and tell him to do it, Madame Buku,
Yes.
or you grab his hand and just put it gently on his thing and then let him do it. But you want him to constantly stay aroused. So then you start licking it. You can lick it, kiss it, suck it, tongue fuck it. I typically start off with a lick in a circle.
Okay.
And then I make sure that my tongue and my mouth is really wet, so that it's sliding and it feels really comfortable and not rough. And then, gently pickaboo is what I say, the tongue into the hole, into the sphincter. So it's like, think of a pickaboo, like pickaboo, like that's how you do it with your tongue, right? Surprise, bitch, I'm in ya. So you just, you do the tongue in and out a little bit to see how he reacts to it.
Right.
Now, the prostate is still getting stimulated in this.
Right.
Now, if you want to take it to the next level, again, that night or another time, then that's when you insert your fingers the way we talked about earlier. But you want to lube. So you want to over lube sometimes. And then let's talk about preparation, right? Okay.
Yes.
So once you have interest, so we talked about the 101 kind of introducing, you might want to wash your man or whatever.
Make sure your hands are clean.
Make sure your hands are clean, or if you don't take a shower together with him, when he comes over your house, just encourage him to hop in the shower. But once you all get more advanced in your activities, you might want to also encourage other things, like, making sure he uses the bathroom before he gets in the shower. Even telling him what tonight is going to be, Madame Buku, and letting him know.
Tonight is going to be an enema.
Right.
Darling.
I want you to stop eating around 3. And
that's good to know.
and that's if you're not going to do an enema. If you are going to do an enema, it doesn't matter when he stops eating.
Right.
But then you want to do an enema. And when you do an enema for these purposes of just the prostate stimulation, you just do it once or twice. But depending on how deep you're going to go inside of him, then you might want to, the rule is you do enemas and you keep doing it until the water comes out clear.
Okay.
Because if you plan on hitting that third hole, which anything 7 inches or larger is going to hit that third hole, then you might want to make sure everything's clean.
Okay.
So we also want to talk about nails,
Okay.
fingernails. And for me, if I know that I'm going to be playing in this way, I do make
Playing
sure
in
that I
this
have
way.
a digital.
You're gonna be
tube.
digging in some booty.
Cut the tip. I usually cut my nails down, and that's for his comfort.
Yes,
So,
absolutely.
yeah, that's for
And
his
there's
comfort.
some guys who wouldn't mind the nail,
They don't
actually,
mind.
the pointy nail, because even if you look into pegging, some of the actual short little dildos that are the peggers or whatever the hell they're called, that goes into the strap, are pointy.
Right.
And guys go absolutely fucking crazy when their lady is
They do.
using that. It's pegging them.
When their lady is pointed with them.
It's pointed.
They go crazy.
They go crazy.
Oh.
I can show you a lot of porn, and I've been in situations where I've watched it.
Okay. So, as far as the milking, what you had described,
Okay.
does the BDSM community, okay, get into that.
So the milking piece, the reason why it's called milking is men, we naturally secrete fluid out of our anus. Even if your prostate is not getting stimulated, a guy, heterosexual guys may not admit all this to you, but a guy, like, even after he had sex with you and he go use the bathroom, he might feel like he has to defecate, but when he goes, all comes out is milk and clear fluid, or it might be both. But the fluid is going to come out first. So that's the cream, right? Because your prostate is getting stimulated and it's pumping. It's the engine while you're having sex, especially if you're edging. Edging means to stop and go. We can talk about that another time. Then it's secreting fluid. When you are milking a guy and you're stimulating his prostate, if you're doing it right, which is maybe taking the fingers, one finger going up and down over it, or two fingers going up and down, or in circles, or going in X's or zigzag or whatever, fluid might start to come out, and it's cream, as y'all call it cream, so it's milk, but fluid might come out because that's the prostate.
He's ejaculating.
He is
it's a membrane, so there's mucus. It sounds nasty, but it's a membrane, and so it does secrete. The other thing that I have experienced is if I am stimulating the prostate, that the fluid that actually pushes semen out actually encourages some premature ejaculation of fluid out of the penis as well, and so that it can be coming and going.
Yes.
And do you feel that milking is beneficial? I mean, of course, sexual pleasure benefits and also medical benefits.
Absolutely. So when your prostate is inflamed, that's an issue, right? So it causes all those other issues that we talked about earlier, which is why doctors check. Typically, doctors check with men. Again, we're not MDs, but typically doctors check on men at the age of 40. I would recommend, if you're having any type of symptoms, 40. If you're having any type of symptoms, get checked ASAP. A friend of mine was having issues urinating, and he went to the doctor twice for it, and the second time they checked his prostate, and he's 30 something. But yes, you want to make sure. And then typically, so people who typically get penetrated all the time in the ass, whether it's by your lady or another guy or a dildo, whatever, they typically don't have inflamed prostates because it's constantly getting hit. Getting your prostate stimulated, getting it hit is your G-spot, and it is the best orgasm ever. It is not, guys, the feeling that we feel when we are about to come, that is the feeling the entire time. The entire time is getting played with. It's that feeling when you're about to come. It's fucking amazing.
Yeah, and this is for our male audience, but for our females that listen to this, I mean, and we could do another episode, and we would love to have you on Mr. Fluid for that, as well as women having anal sex. Yeah. Because and I don't know how, because I'm not a male, I don't know how the anal ejaculation or milking or whatever, but I know how it feels when I have anal sex, and to have an orgasm out of my ass is like the best. It's actually better than having an orgasm out of my vagina, my pussy, so it's like,
say pussy again.
Pussy. My so a lot of people, I guess what I want to leave this with, and we can do what we always say, our takeaway, because we have straight men that really get into, no, I don't want this done because just you in that area. They have some ways about it,
preconceived notions.
Exactly. And they really need to get over it, because really this is medical benefits to it and sexual pleasure to this.
It's a win-win.
So it's a win-win. So what do you say the takeaway is for our audience and those that are listening? Because we're hoping that everyone is listening to our show.
Well, I think that for women, I think you need to be patient, and you need to be deliberate with your movements when it comes time to introduce your guy to this. You need to also understand that everyone's not doesn't have the relationships like Madame Beaucoup does with their mates. So a guy might look you in the fucking face and lie to you because he think that you're testing him or something. So it's good just to, if he's comfortable with you, just be gentle and go slow with trying it out. I promise you he's going to love it. And for guys, I really feel like in 2020, even older generations are now still moving kind of in this direction that, like, because, you know, millennials, we have been like, whatever, what the hell is the problem? And Gen Zs are like, what is this thing called sexual orientation? Who the hell cares? So, but I feel like even the baby boomers are kind of moving in that direction. So just be open to trying new things. What's the worst somebody gonna say about you? That you're a freak? That's not necessarily an insult.
Right. I agree with you. I actually say thank you.
But be open to it. Like Madam We said, it is sexual stimulation as well as for medical reasons. And just live life and just fucking have fun. Like, why have, you know, so many rules and laws? Yeah, fuck what everybody else thinks. Have fun. Get your nut.
Get the stick out your butt, secondly. Or maybe
you
want to put it in. So, Madam Boku, do you have any takeaway for our audience for this episode?
You know, really, and this is for, you know, both the men and the women, to just familiarize yourself with your sexual anatomy so that you can create an environment of comfort if you're going to explore in this way, if you're working with a partner, to make sure that they're comfortable. But also, you know, you can get into a headspace where you know where you're going when you get in there. You know, Mr.
Which way do I go?
Three chambers, and you know, you might not know that there's a third one back there. So, you know, just get familiarized with it so that you can create a sense of comfort.
Yeah, and this was a really good episode. I mean, as far as my takeaway, I mean, I like the fact that Mr. Fluid explained the three chambers, because yes, a woman's ass is different, and as far as how you enter, how you different positions for anal sex and so forth. But I like the fact that you gave us the how, the when, the why, and everything to help our female audience listeners to know how to take it to the next level with their man, their lover, because I know I'm trying to get to that point with mine. So this definitely is gonna help that. But I definitely say get to know men, just like we constantly say for females. Get to know your G spot, know your body, explore your body. But men also get to know your P spot. So, you know, hey, women got a G spot, men got a P spot.
Yes.
Yeah.
It would be helpful if guys found it on their own. I know some heterosexual married men who found it on their own first.
Yeah.
They found it on their own first, and then they let their wives do it.
Yeah.
But they shared this with me because I share all of my fucking stories about the people I licked.
And I agree with you. I mean, I think that maybe that can be the prepping process to be able to communicate, explore on your own.
Yeah.
So then you'll see that it may not hurt as much as you think it is, or because, you know, they may be scared, they may have some phobias or something, or some psychological issues of, oh, maybe my manhood be questioned because it hurt, because of the pain, not so much because you're going in my ass.
Yeah.
You know what I'm saying? So it's like, and I'm this man's man, and then my woman seeing me shed a tear because she went in my butt, and it was painful.
I feel like that's what some guys would think. That's why they'll say, no, I don't want to do it.
And that was my experience. Is there's a number of men that I've dealt with that did not want to share this with their girlfriend, did not want to share this with their wife, because they did not want to seem vulnerable in that way. And so they were more comfortable with me doing it. Because we don't know each other, and you know, I don't spend, you know, I don't have responsibilities with you. I don't have to, you know, show up in this way, and you have to show up in that way. And they had their outlet, and so that's what it was.
Anyone that wants to come in for a personal demonstration with the three of us, please comment below.
Well, that will definitely make it interesting show.
And with that,
with that being said, well, thank you for joining us, Mr. Fluid. We would definitely love to have you on again. I feel like our next episode should be anal sex. The tips of having anal sex.
I might be expert in that, Larry. Yeah. Maybe.
Yeah.
The depths of hell.
Yeah.
The depths of hell.
And therefore, we have a male and a female perspective.
Oh yes.
Yeah. So yes. Until then.
Au revoir.
Au revoir.
Peace, y'all.